What organs can immune system affect? It can affect head to toe several organs, causing heat, inflammation in the blood vessels or the organ structures or the glands, and lead to a malformation of the organs, and thereby essential function of the body is disrupted. So it's not just the joints, it can affect several organs. The manifestations of autoimmune rheumatic diseases can be varied. Patients can present with a rash or sun-induced rash or mouth ulcers or severe hair loss or joint pains, which is first thing worse in the mornings, or low back pain or heel pain worse in the mornings, chest pain or rib pains worse first thing in the morning. They can present with severe weight loss mimicking a blood cancer or a tuberculosis, because the autoimmune diseases generally tend to reduce the appetite. They can produce fever like symptoms because of a chemical called interleukin 6, which can be produced in excess in autoimmune diseases, and that can cause fever, weight loss, loss of appetite, night sweats, and excessive joint pains. In extreme cases, patients can go anemic, leading to severe tiredness, breathing difficulties, and palpitations or racing heartbeat. In situations where kidney is affected, the first thing to notice is excessive protein in the urine causing swelling in the body or swelling in the feet, which is first thing in the morning or with prolonged standing or prolonged sitting. So generally we check the urine test to check the protein levels. Other tests we do in autoimmune diseases is we check for hemoglobin count, white cell count, platelet count, ESR and CRP, which are inflammatory markers, and we check for urine test, we check for creatinine, electrolytes. We check for antibodies such as rheumatoid factor done by nephelometry or anti-CCP done by ELISA method. We check for anti-nuclear antibodies done by both ELISA and immunofluorescence. We check for ANA profile or blot test to subtype the antigens. We check for ANCA or test by ELISA or ANCA profile test. And when we are thinking of about young patients having blood clots, such as less than 45 years having heart attacks or strokes or recurrent pregnancy problems or abortions, we check for antiphospholipid or APLA antibodies. Please note that we as immunologists, we rely tests from NABL accredited labs, and specially labs who have been trained to test these autoimmune tests, as they require special microbiologists, pathologists and hematologists to look at these and give interpretation of tests.